أنا أتنتظر.
Mute yourself. Mute yourself. Dr. Anita, please mute everyone.
Okay, sir.
Today we are going to yesterday we have done YNSA basic points A, B, C, D, E, F, G, H, and I. I hope everyone is well understand with these points and how to noodles these point. I hope everyone is now understand. So today we are going to learn basic nurse. Today we are going to learn sensory points. There are 4 sensory points: eyes, nose, mouth, and ear. Then 3 points of brain: cerebrum, cerebellum, and basal ganglia. Now we start with the basic points. If there is any question and any misunderstanding to anyone, then please ask before the class. Write in chat box those are not understand with the basic points. Okay. Everyone is understand with basic points. Yeah, we do young points, but first of all, we are doing yin points. I am asking about basic points. If you are not understand, then write in chat box. Am I audible?
Yes, sir.
Yes.
Okay. Anyone have any doubt for basic points? Otherwise, we are going to do sensory points. What is the location of eye point? Eye point is 1 centimeter down to A point and 1 centimeter lateral. So it is visible to everyone. So
Yes,
Yes,
sir.
boss.
when we are going 1 centimeter down, 1 centimeter lateral, we have a line, this line. Okay. And yesterday I told you about a point. Then this is a point. Today I mark again 1 centimeter up and down. This is a point on both sides. Okay. 1 centimeter down and 1 centimeter up from hairline. Then from a point and from hairline 2 centimeter. There is a point. This point is eyes point on both sides. You see, this is eye point on both sides. Then again 1 centimeter down and 3 centimeter from hairline, there is a point C. Here, that is nose point. This is nose point. Then again 1 centimeter down, there is a point. This is the point, mouth point. Which point? Mouth point. These all 3 points visible to you all or not? Now,
They are
top
quite
point
visible,
is
sir.
a point, then eyes, nose, and mouth. Okay.
It's visible, sir.
Yes.
Very visible.
Okay. Then we go with this line. This line is 45-degree line and connected to point C. You see this line? Yesterday we make. Today, magenta. I make it again, so you are well understand. Like this. So when it cross between this point, this is eyes and this is nose. Between these, when you make a cross on this line with point here is point. This point is ear point on both sides. Okay. Now what we have to do for needling, we have to palpate this point with a probe or with your nail of thumb. Like this, with equal pressure, then it is painful. You find a painful point, then you have to put one needle in down position, like it is visible to you, like this, top to bottom, like this. It is visible.
It is, sir.
Yeah.
Yeah, it's visible.
It is visible, sir.
Yeah. Then eyes point used for all type of eyes problem. All type of eyes problem. Okay. Then second point is nose point. Then this point is used same as eyes point from top to bottom. Like this, you have to use nose point. The nose point is very useful for all kind of nasal problems, sinusitis, mucous membrane related problems. Okay, smell disturbance. When you lose the smell, then you can use nose point with a point. Now, most important point is mouth point. Mouth point is used for all type of mouth problem, salivations, Bell's palsy, and chewing problem, gum swellings, tooth pain, all type of mouth pain. You have to use the point mouth. You should needle top to bottom like this. It is visible to all. 3 points you can see like this.
Yes, sir.
Okay. Already I have shared the PPT for more details. So you read that PPT. I am only showing you demonstrations because in previous classes we have done all the indications and all the things. So these points you have to use. Then you have to use ear point, how you put needles. You have to put needle like this on lateral to medial. Okay, like this for ear point. For all type of ear problems, deafness, ear pain, hearing problems. Okay, so you have to use ear point. You can combine mouth point with the nose point and eye points, and you can use all the 4 points in ear problems. Okay, because sometime there is ear problem due to much mucus, and nose point release mucous membrane. Then it is very useful for ear pain also. Then mouth point also useful in ear pain. In this way you have to put needles. Okay, when you see a patient who have so much sinusitis and so much mucous membrane is disturbed, then what you have to do, you have to do bleeding on tip of nose here. You have to bleeding tip of nose. You can visible here like this and remove needles, then squeeze the blood. It is very useful for all type of sinusitis and very good results. You have to properly bleed this area. You see, nasal obstructions, then you can use this bleeding point and you can use.
Prof, please unmute yourself, sir. Thank you.
Yeah. Now it is visible to you all.
No, sir. Your video is off, sir.
Okay.
It's okay, sir.
Now it is visible to you all.
Yes, sir.
Yeah. Then for nasal obstructions, you can use these points. For membrane, mucous membrane problems. Okay. Bleed this point and put needle on these points with both nose points, like on both sides.
So your video is clear, but we're not seeing it too well.
Yeah.
The nose side, the lower part.
No
the-
side is not clear to you.
It's not clear, sir. Okay.
Now all the point is visible to you.
Yes, sir.
Okay. For all type of nasal problems, mucous membrane problem, and sinusitis problem, rhinitis problem, you have to put these needles. Okay. Now, if you have any question regarding sensory points, then please ask your question. Unmute all so they can ask their question.
Hello,
Hello,
Prof.
sir.
Yes,
Hello,
yes.
Prof. Please, sir, can
Yes.
you kindly repeat the sensory part again, sir, please? Because the network was not fluctuating.
Okay. 1 centimeter up below the A point. You see A point? Green
Yes,
color
sir.
is A point.
Yes, sir.
Then there is red point. This point is eyes point 1 centimeter down to A point. Then again green point is 1 centimeter down from A point, eye points, that is point. Then 1 centimeter down there is blue point. This point is for mouth point, and this point you see when you draw a 45-degree line here and you go between eyes and nose point directly on this area, then this is ear point. Needle directions top to bottom. And when you have a sinusitis problem, rhinitis problem, loss of smell, excess mucus in nose obstructions, running nose, then you have to use bleeding on this point. You see blue point on nose, and you should use needles Li20 on both side, then nose point both side. The sinusitis, rhinitis, all are finished. Okay.
Prof. Yes.
Yes.
Now, between the midline and the sensory organs, how many centimeters, sir?
1 centimeter.
Okay, clear. Thank
Any other question from anyone?
Please, sir, how many centimeter Between the nose point and the ear
There is
point.
1 centimeter gap from all the points, but you are asking about ear point. Then on both sides, when you go for C point, then C point and this line, magenta line you are watching, okay, where it cross between these points, this is the middle line, crossing line. 1 minute, see.
Okay,
Yeah,
okay, sir.
like this. When you putting center point between nose and eyes, there is a center point and you cross the line, then there is the point ear point, and it is approximately, if I tell you, then it is 3 centimeter lateral from mid sagittal line. Okay. Any other question from anyone?
Thank you, Jacob. Please, I need to repeat the F and G concept.
Repeat your question. Now it is visible to all.
Yes, sir.
Yes, sir.
Then repeat your questions. If you have any question, then repeat.
Hello, Prof.
Yes.
Yeah, so after the bleeding, if there's a serious congestion and everything, after the bleeding,
Yes.
the other 2 points under the nose there.
Yes. You can use all the points around the nose point, okay, with
Yeah.
nasal bleeding on tip of nose. You see tip of nose, I put a mark.
Okay.
This you have to bleeding here for nasal obstructions.
Yeah.
And more mucus and activate to mucous membrane. Then running nose, rhinitis, sinusitis, loss of smell. Then you use bleeding on this area. It is very, very wonderful results.
Okay.
Okay.
All
Now,
right.
Hello,
ja.
Prof.
Yes,
When
my sister.
when needling, can we should needle both sides or one side?
Both side, no problem,
It's okay.
because you know the system of breathing system. When you are taking breath, okay, then for 45 minutes there is one nose is running. On another 45 minutes, another side of nose running. Nostril always not running same side. It change the side after 45 minutes. If now you are taking breath from left nose, then after 45 minutes you can see it will be change to right. If you are now taking right, if you, now your right nostril is going on, then after 45 minutes it is left running. Okay. Now ask your other questions. If you have any other questions, then please ask. Okay.
YNSA, Prof.
Shall we go for brain points? Or you have doubt?
Brain point, sir.
Yes. Then we start base brain points. Okay.
Okay, sir.
Okay, sir.
Okay. So about brain points, as you all are now, there is brain point. This is point A, and it is above 1 centimeter from hairline. You see, it is clear. A point is 1 centimeter above. Okay. Then after A point, there is cerebrum point, 2 centimeter long point, and it is running 2 centimeter long and 1 centimeter apart from center point. Like it start from 1 centimeter and going for 3 centimeters. Okay. Then this red line is sorry, I changed the color because middle line is red line. So I can see another color. I think this color is good. Not this point. Okay. This is cerebrum. Now the indications of cerebrum, who have remember? Cerebrum is the most big part of the brain. This is the part of skull. 1 minute, I show you. Which part is cerebrum? This part is cerebrum. Okay. This all is cerebrum. Then there is lobes in cerebrum. This is temporal lobe, and from this gyrus, it is parietal lobe. This is frontal lobe. From this line, this is frontal lobe. Because here you can see very clearly, this is precentral gyrus. You see, it is coming down. It is visible to you. This is coming down. It is precentral gyrus. Then this second line is postcentral gyrus. This area is from both sides is frontal lobe. Then This area is temporal lobe. This area. Okay. Then this area is, you see here, the gyrus is going like this. It is occipital lobe. And going like this, it is parietal lobe. Then another part is, you see this part, both two part, it is cerebellum. Okay. Now I show you how it is managed. It is cerebellum point. It is cerebellum and it is the beneath of occipital lobe. Now it is occipital lobe and this is pons medulla and medulla oblongata, midbrain and all. This line you are watching, it is corpus callosum, then ventricles behind this. Here is the ventricles, you see, can easily see. These all are ventricles. And the fourth ventricles is here. Okay. In this way, when you are treating this big part, it is cerebrum. Then all the problems in paralyzed problem, full body paralysis or half body paralysis or quadriplegia and paraplegia, in all conditions you should use cerebrum point for all type of brain related problems. Then you have to put needles on point A, B and C. One minute, I take needles. Then I told you how to put needle. Here's one pouch. Yesterday I opened. I have not find. Then I told you about the needling of. You all are known about the area of and use of cerebrum point, or I repeat.
Prof,
Yes.
please can you repeat it? Thank you.
Okay. Then I told you about cerebrum. Cerebrum is most big area of the brain. Okay. When there is paralysis and any ischemic stroke, then you have to use cerebrum points in all type of paralysis. cerebral is a 2 centimeter line. Okay. Then it is used for acute and chronic neurological problems, short and long term motor problems. You know about motor problems when you are doing any work, that is motor moment. Okay. When there is any distraction in that moment, that is motor problems. Psychiatric disorder, attention deficit disorder, attention deficit hyperactivity disorder, sleep and memory disorders, and hormonal disorders. You should use this point, and you have to use needles. A point. First of all, you put needle on A point, then you use another needle for 1-2 needle. If you are using, then it is only one needle is enough for cerebrum and cerebral point. It is only one needle is enough because it is 2.5 centimeter and the point is 2 centimeter. Although if you want to use half 2 needles, then you can use 2 needles like this. Okay. Then another second point is, next point is which point? 2 centimeter long. It is cerebellum point. And it is also 2 centimeter long line above the hairline, and it overlap the part of the cerebral zone. This is the point going like this. Okay. And it overlap here. This area is overlapping area. Then cerebellum is the use of cerebellum, all type of balance disturbance. You see, sometime after paralysis, some patients are not able to walk properly and they have not balance. They have a zigzag problem. Okay. Then you can use these points for zigzag problems. And you have to use the needles with anterior to posterior like this. Okay. Like this.
Hello, Prof.
Yes.
Sorry, my network is fluctuating. That place you are needling, is it the cerebellum or the cerebrum?
Now these two needles are for cerebral and these two are for cerebellum. If you are watching the green area needling, that is cerebellum area. Then between beneath this, between two greens, there is a cerebral area. Cerebral means cerebrum, this most big part of the brain. You see, this is cerebrum. Cerebrum have two hemisphere, different. Then there are if on right side problem in this area there is any artery, these are arteries. If that is blocked and here is not proper oxygen, or if there is infarct, then there is bleeding that occupy the area of sulcus area and compress the gyrus area, so it disrupt the motor moment. Then you have to use needles bilateral, opposite side of problem. If you have any patient those have problem in right hand side paralyzed, then you have to needle on left side. But in Toshika Yamamoto, you have to go with elbow diagnose, then stomach diagnose, then neck diagnose. Now we are doing only basic points. After these basic points, I will show you all the points of Y spleen and cranial points. Now it is clear cerebellum point and cerebrum points. Clear to all?
Yes, yes.
Then we are going for find out a area named by most important area for cerebellum and both sides cerebellum, cerebrum and a point. Then there is area 3 centimeter long, 0.5 centimeter apart from middle line. That is the basal ganglia area.
Both side paralysis. Both side is paralyzed. So we need to needle the both side.
Yes, yes, on both sides.
Okay, okay. For how many minutes are we going to leave the needle?
Yesterday I told you about 20 to 45 minutes, and you can put needles more than 45 minutes. Okay, then
But if
this
you can't have a speech disorder, because there are some, they have a speech disorder.
brother, when we go for speech disorder, then I will tell you the points, brother.
Okay, okay. Thank you.
Now I am telling you about basal ganglia. So it is 3 centimeter long line, and it start 0.5 centimeter apart from mid sagittal line, and it is you can say between mid sagittal line and cerebrum line there is basal ganglia points on both sides like this. This black line is basal ganglia line, and this line is used for balance problem. Okay, for Parkinson and motor movements, involuntary motor movements in Parkinson disease, and you have to use needles anterior to posterior like this. Oh, sorry, I am removing this is the basal ganglia area. I put needles on black area, then I remove these needles, because if I put needles there, then you are confused. These two lines are for basal ganglia needling. Okay, like this. You have to put needles like this if there is any problem in balance of body and involuntary movements, Parkinson disease, and cerebellum area. You see green area, this green area, when there is a problem in cognitive disorders and all. Attention, language, learning, executive functions, social conjunctions, all are covered with cerebellum points. Okay, like this. And you can use all these points for all type of brain problems. Then you put 4 needle one side, 4 needle one side. 8 needles, you can cover all the brain areas. Yeah.
No, Prof.
Yes, my sister.
Please, sir, between the midline and the Basagilan line, is it
Yeah.
half centimeter?
Yes, half centimeter.
Yes, okay. So the length of the Basagilan
Line
line,
3 centimeter. 3
three,
centimeter. Ask your question, and I request to Dr. Anita, they clarify the questions. If there is any problem, then I will clarify. Yes, ask your question. Please ask your question. I told you, everyone, my father's health is not so good, so I have to take care of them. Sorry for that.
Hello, sir.
Now ask your question. Yes.
Hello, sir. The
Yes,
basal ganglia line
Yes.
run closely along beside
Hmm?
cerebellum and cerebrum.
Yes. And
So the
there is
length, the
5
length of
centimeter gap. Yeah, 5 centimeter gap between cerebrum and mid-sagittal line. This line, today I again mark this line, no problem. This is the line of mid-sagittal line. Okay? It is going like this. It is mid-sagittal line. Then there is points for cerebrum and cerebellum.
Okay, Prof. I want to ask a question.
Yes.
Is it correct to say that the basal ganglia line is
Yes.
2 centimeters above the hairline?
Yes.
Thank you, sir.
Ask you more questions.
Hello, sir. Hello, sir. Hello, sir.
Yes.
I was off network when you were on cerebellum. So I don't know if you can make a recap for me. Thank you, sir.
Yeah. Cerebellum is used for all type of disbalance, because cerebellum is balance our body. When you have problem of balance, spatial orientation and coordination of movements, speech, thought, learning, emotions, hormones, cognitive dominance, attention, language, learning, executives of functions and social conjunctions, then you have to use cerebellum point.
Okay, sir.
If now you have any doubt, then please ask, no problem. You ask me 100 times,
Okay.
I repeat my
Good evening, sir.
knowledge 100 times, no problem. Yes, my sister.
Yeah, my question is, you went anterior posterior. If we go the other way, will it still work? Because sometimes we could have certain patients that they might not even be able to sit up, or their positions will be so bad, and you'll be wondering what will happen if you go the other way. Will it not still work if I go posterior, anterior?
Yeah, I am telling you, you can go for anterior and posterior, no problem. But when you are going for another way, like this way, then I clear your question very easily and very simple way. Now, if I put one needle like this and it goes one chun, then it is goes approximately here. Then put second needle, then it cover all the area. Like this. It cover all the area. Okay? With two needles. I cover the full area. But if I am putting needles on another head like this, then how many needles I have to put?
Okay, I get you. We use more needles.
Yes. Then I told you another way also, no problem. But if you're using the needles like this way, then it take more needles. But when you are going anterior to posterior, then you have to use less needles. About 4 needle each side, cover all the 3 brain areas: cerebrum, cerebellum, and basal ganglia. 4.4 needles each side, then 8 needles cover the full brain area, like this. Okay? Like this. You cover all the areas. 4 needle on one side, 4 needle on another side. You have to use like this. And you cover all the areas. Cerebrum and cerebellum, all the problems of brain you can achieve on with minimum needles. Okay? All points are clear to everyone? 4 and 4. Today we do.
Hello, Prof.
Yes.
Yeah, if we have cause to needle the cerebrum and cerebellum, and at the same time the basal ganglia. So how many needles are we using now? Because we are needling the opposite side too, which means it will be more than 8.
No. 8 needles. 2 needle for 1 needle for cerebrum and 1 for cerebellum.
Okay.
On both sides, when we are putting, there are 4 needles. Then
Okay.
4 needles we can use for basal ganglia.
Okay.
Then 8 needles cover the full body. And if
Okay.
you use 10 needles, then you can cover a point also.
Okay. Thank you, sir.
Hello,
Okay.
Prof.
Yes.
Now, what is the needle centimeter? Which one are we using?
I am using 25 into 25 needles. You can use 13 into 25 needles, no problem.
Okay, sir.
And you can use 25 into 25 needles. Okay. When you are treating the patient with diagnose all 3 points: basal ganglia, cerebrum, and cerebellum. There is in elbow diagnose, they are above the elbow. crease, then outer side on radial side. Outer side from your body, there is the point is cerebrum. Then in between there is basal ganglia on tendon, biceps tendon. Then on middle side there is cerebellum point. You can palpate on both hands. Then you choose the needles. On which side you have to put needles. If you want to use less needles, then you go with diagnose. Which point is disturbed? It is basal ganglia disorder, or it is cerebrum disorder, or it is cerebellar disorders. Cerebellum disorders. So you can go with the elbow diagnose. Dr. Anita, please, I request you, you share once the PPT Acharya YNSA Acharya PDF.
Okay, Prof.
YNSA Acharya PDF. Now you are visible to see this dummy. All are visible to dummy. Okay, then go for 42 number
Yes,
page.
sir.
Go for 42 number page. 42. 42. Then see here is elbow diagnose. My sister, I think YNSA Acharya PDF, 100 page PDF. If you are going with this, it is not there. There is one PDF of 100 pages. See which one is 100 page. There is 136 page, my sister. I think on first, you see first. There are two PDF, my sister. One is 100 page and one is 36 page. I have not remember on this PDF which number. See elbow diagnose. Dr. Anita. Hello. Yes, Dr. Anita.
Yes, Prof. I'm with you. I'm trying to get it, sir. I'm trying to get it.
On first of all, I share the PDF.
Okay.
YNSA Acharya. You open two PDFs now. Then both two have 136 image. Then you in only the image of elbow diagnose. I want to show you elbow diagnose. Because it is abdominal diagnose. It may be in last. It is elbow diagnose. Yes. See in this. You see in this image, elbow diagnose, cerebrum, cerebellum, and basal ganglia, and lumbar, cervical, and thoracic spine. Now I clear all the things with the all these 6 points. Okay. When you are palpating right hand or left hand, then the point is painful. Suppose that the point is cervical point is painful, then you have to use point A on same side. Which side is more sensitive? You have to use point A. Then if you find basal ganglia point is very painful, then you have to use basal ganglia point. Yes, this point is painful, then you have to use needle on basal ganglia point on the scalp area. After needling on scalp area, the sensitivity of this point immediately goes. There is no sensitivity after putting needles. If it is still remaining, then check and redirection your needles. Slightly redirection your needles. And if there is lumbar spine pain, then you have to use the area of D1 area and D. And if you have thoracic problem and your elbow diagnosis is saying you to the thoracic point is very, very sensitive, then you have to use which point? For thoracic, which point you use?
D points.
E points. E point. Okay. On the same side. After putting needles on E point, the sensitivities immediately goes out and you got good results. Okay. Now, if you have any questions, yes, ask me your questions. Now, I talk with you, journal, about my experience. Once I see a patient and she have vomiting sensation and there is ulcer in esophagus area. Then I use E point according to thoracic elbow diagnose. Then I use vagus nerve point on both side and both side thoracic point. Next day, the patient is very happy. He is able to eat and drink some juice and eat some fruits. And he is very, very happy. After 15 days, he is completely cured. Only with these points. Vagus nerve and thoracic point with diagnose. So many times I put needles after diagnose on lumbar area D1, then most of patients take 1 or 2 treatment for back pain and they are cured. And even after 5 to 6 years, they are not returned back for the same problems. They come with another patient and they come with another disease. But the problem of back pain is not there. Only for 1 or 2 sittings. Sometimes it may be take more time, but in almost cases, it is very good results. And if you are going with proper diagnosis, then I am very, very sure you got 95% positive results. Always 95% positive results. I achieve these results. Not on a single patient. I have treated more than 10,000 patients and all have very good results with YNSA treatment. So if you have any doubt and if you have any problem to knowing and putting needles, then you ask.
Hello, sir, Prof.
Yes.
Please, like how many times we do this thing and see the good results?
Repeat your question.
I said like how many times we have to repeat this treatment for the patient?
It depends on your diagnosis. I told you just now, if you have a good diagnosis, then 4 to 5 treatment is enough. If you are putting needles without diagnosis, then it will take time because you are not treating root cause. You are treating only symptoms. There
Prof.
in YNSA there are diagnose area, elbow diagnose, neck diagnose, then stomach diagnose. Okay. So after
Prof, well done,
diagnose,
sir.
yes.
Hello, Prof. Hello, Prof. Please, can we
Yes.
needle this elbow area, everything at the same time? I don't
Yeah,
know if you
yeah.
mentioned it.
On same side. On same side. Sensitive area side. When the sensitivity is less and LI4 diagnosis is not clear now. You are treating a patient with the basal ganglia problem. Okay. Then you put needle on very sensitive area. First of all. Then check again sensitivity. Okay, there is no sensitivity. But when you check again LI4 diagnose area, there is sensitivity. And you find still there is painful. One side is more painful. Then go for opposite side also. Less side also. Sometimes both side is tender point. Then one hand's sensitivity is gone, but another have still there. Then you put on both side needle. I told you first you do LI4 diagnose, then right side is very painful. Okay. Then you go for elbow diagnose on right side. There is basal ganglia is more tender. You put needle on right side basal ganglia point and sensitivity is gone. Now you check the LI4 diagnose. Now left side is more painful or right side is still painful. Then you go for another hand's diagnose and check the point. If there is the basal ganglia on left side also painful, then put needle on left side also. Otherwise, you go for neck diagnose. There is kidney point is tender, then you put for kidney point. Okay? No, you stay here. You are not going for help. Yeah. Okay. These 6 points are very important to know how to diagnose these 6 points and how to needle these 6 points. And today we cover upper 3 parts of basal ganglia, cerebrum and cerebellum. Yesterday we read about E point for thoracic, then D point for lumbar, and A point for cervical. Then elbow diagnosis finish. Okay. Now I am telling you a trick how to make a protocol. See, there is a one patient and she have irritable bowel syndrome. Then how you make a protocol? First of all, we have to use which point? D point for lower limb. Then D1 to D6 is also for lower limb. Then H and I for lower limb.
Sir, the line is not clear. I'm not hearing you clearly.
My sister, I think you have network problem or all are not audible to me. I am audible to all or only to Krishna Patrick have problems.
You are
audible.
audible. I think it's a network.
You're audible, yeah.
Okay. If my side there is network problem and you all are face my voice is breakable and all, then you tell me please. So you make protocol for irritable bowel syndrome. Use point A for cervical region. There is no use. Then B, there is no use. Then C, there is no use. Then D for lower limb. D1 to 6 for lower limb. H for lower limb. Okay. Then which point? E point. E for thoracic region. There is stomach. The stomach and liver and gallbladder. Then spleen. All are between thoracic cage. Okay. So use E point. You should know anatomical locations. Then use abdominal diagnose or you put directly one needle on vagus nerve on both sides on scalp. Because vagus nerve treat the full body. Vagus nerve is very, very important. So always treat vagus nerve. If you are treating any type of patient, first of all, you put needle on ears and men. Make it a habit. First needle on which point? Ear, sandman. When you put first needle on ear sandman, then it have a analgesic point and effects, then putting needles, they are not more painful. Then second point, I told you, you put DU24, scenting point. These 2 points, then always remember vagus nerve point. Suppose that you are not know anything about any physiology, any muscles problem, and you are not understand with anything, then you put needles on mid sagittal lines apart 1 centimeter. Okay, put 5 needles continue. When first needle is end, then start second needle. Where the second is end, then start third needle. In this way, how much you are putting in 5 centimeters from hairline to? If you are using 5 needles, then how much area? You treat 10 centimeter area, and it treat all the superior frontal gyrus. Okay, that is, and it also treat the lower limb area and precentral gyrus. So it is most important to use 5 needles for all type of pain on arthritis pain. If you have patient with arthritis pain, then bleed 11.16, 11.16 Tunga acupuncture point on little finger, then bleed ear apex and use vagus nerve point. Then you have very good results. And second thing I told you, when you are treating scalp, then it treat kidney very, very nicely. Because in Tung scalp acupuncture, Master Tung always told bone treat the bone and bone treat the kidney. If there is any inflammation and there is any problem in kidney and in bone, then you put needle near the bone. And our school is the biggest bone and strongest bone. So when you are using for scalp acupuncture, then it is treating very well the full body. If you have any question, then please ask. Tomorrow, if we are not putting any message for class, then tomorrow on the same time on 5 p.m. Nigerian time, you can join the class. Tomorrow we are doing Y spleen point and cranial nerve points. First we do that point, then in one day on tomorrow we do cranial nerve point and Y spleen points on yin side. Then on next day, day after tomorrow, we do all the yang points. Okay. Then I told, I think I have no use. I think I have no need to teach you again neck diagnose and abdominal diagnose and stomach neck diagnose, abdominal diagnose. And if it is necessary, then you told me. I can repeat, no problem.
Yes, sir. We will
Hello,
appreciate
Prof.
it, sir. Hello, Prof.
Yes, yes.
Sir, please, You were saying something, though the network is really, let me say, it's friendly because it's not at all. So,
Oh,
you were saying something, sir, that
Chaya, don't don't forget you have a very big heart, Dr. Anita, and they are recording this Zoom session and they will share with you. And when you have a good network, then you learn this.
it's okay, but I
Okay?
still have a question, sir.
Yes. Ask.
Okay, my question is this. You said if we want to get a good result, Prof, as a practitioner, we should first of all do the ear semen, one,
Yeah, ear segment.
one, then two, the vagus, is it vagus
Vagus nerve.
point,
Vagus nerve.
vagus nerve point, two,
Yes.
then three, do 24,
Yes.
then four, the mid surgical line. I don't really understand it, sir. I don't know whether you can demonstrate it on the dummy.
I am telling you a good protocol by this. Always needle on vagus nerve, then ear segment, then do 24 for your safety. Okay, but if you have a patient and pain is not going and you try so much, then you put 1 centimeter lateral to mid sagittal line on one side and 5 needle on another side. On both sides, put 5 needles. Okay. You see, I put first needle from A point, okay, like this. Then second, like this. Then third, like this. Then fourth. It is going for, see, it is going for here. Then I start it from here. Like this. Then I go for another one like this. How you have to see? First needle is I put from here, then it is going here. Then start second, third, fourth, like this. This is going here. I overlap it with this. Then this is going here. Then I overlap this. Then third is I overlap it here. Then this is going here. Then I overlap this. Okay, on both sides. Like this. Perpendiculars. Subcontinuous. Okay, like this. Now it is understand with you. It treat all the cranial nerves. These 5 needles treat all the cranial nerves. Okay. Then vagus nerve and all nerve are included in this protocol. Okay. Then ear segment. Where is ear segment? This is concha. And it is going like this. Then here is segment. Okay. You see, here is segment. This is Sandman. Understand with Sandman?
Yes, sir.
Okay. You see now. It is Sandman. Then ear apex bleeding is most powerful for all disease. Ear apex bleeding is very nice results. Like these, and put needles. If you are bleed from here, okay, to here, this tragus from 4 to 5 pellices. Then first of all you squeeze ear like this, okay, then it become red, then prick this area of ear apex, ear helix, it is called helix. So you have to needle here with lancets.
Prof,
Okay,
is it both sides, both ears, or one?
you can use one day and second for another day.
Okay, sir.
Okay, sometime it may be painful or hard to patient for one day. Okay, if you are putting, so if you are pricking so much, then it is maybe irritate patient. So prick 3 or 4 pellices, not prick more than 4 pellices at a time on one ear. It is better if you are pricking only the ear apex, then it is much better.
And sir, how often do you prick the earpiece?
You can pinch the ear like this. This is ear apex. You are folding your ear, then it is ear apex. Okay, like this. Okay, I will teach you
Hello, Prof.
how to bleed with point locations. Okay. Yes, my brother.
Hello, Prof. Is one
Yes.
needle okay? Is one needle okay for the ear apex?
Yes. It is one needle is enough.
Hello, Prof.
Yes, my sister.
Well done, sir.
Okay.
You said you can also summarize the stomach diagnosis and others that you mentioned. Maybe just
Yeah.
a brief
Neck
summary.
diagnose and elbow diagnose.
Yes.
Yeah. Now can I see everyone? Please open your cameras. I want to see. Okay. Okay, Dolly Mission, Frankens. Justin Dolly Mission. Yes, Dr.
Yes,
Abre.
Prof.
Dr.
Good evening,
Abre.
sir.
Yeah, good evening. Abre.
Prof, good evening, sir.
Good evening to everyone.
Good evening, sir.
Prof.
Good evening. I had night.
Good evening, sir.
Good evening, sir.
Yeah, good evening.
Well done, Prof.
Well done, sir. Thank you very much, sir.
Thank you for the lectures.
I really appreciate your request. I God bless you, sir.
We appreciate that.
Good evening.
Great time,
Appreciate
sir.
to God who gave you birth.
Good night, sir.
Good night. Good night.
Good
Oh,
night.
I think my sister is here.
Yes, sir.
Okay.
Good night, sir.
Nice to say good night.
Good night.
Good night,
Good
sir.
night, sir.
Thank
Good
you
night.
so
Good
much.
night.
Good night,
Thank
everyone.
you so much. Bless you.
Good night,
Yeah,
sir.
good night.
Good night,
Good night.
sir.
Good
And
night, my
thanks for
sister.
everything,
Good
sir.
night, sir.
Good night. Good night.
Nice
Good
sleep.
night,
Good
sir.
night.
All right. Bye, sir.
Bye, sir.
Yeah.
My show.
I want to see Lala. Who is Lala?
Lala.
There is a name, Lala. Who is Lala? And MA.
Yes,
Why
my
you are not
camera is
opening your cameras?
dark because of night.
Yes.
Is it better now? Can you see me now?
Yes. Yes.
Okay. Good evening, sir.
Good evening. Good evening. Dr. Alafia. Good evening. Dr. Fatima. Good evening. Dr. Ebre. How many people? How many persons today join first time? Yesterday or today? How many new students? Those are joining yesterday or today. Please tell me. Who joined today or yesterday? New student.
Prof, I joined today.
All are old.
Greetings, everyone. Is there any new participants? Is what the prof is asking. Any first timer? Though most people have left the class. We are just 35 now.
Okay, no problem.
Some of the people have left.
I am taking attendance only for 35.
Thank you so much, sir.
Why I provide certificate to those who are left earlier? It is I think you have it is 6:30. No.
6:45 now.
6:45 now.
Yes.
But I have midnight.
Wow.
23:16.
Thank
Okay,
you
good
so
night
much,
to
Prof.
everyone.
Good night.
Yeah.
Good
Good night to everyone.
Good
Yeah.
night, all.
Thank you so
Thank you
much.
so much for your time.
Hello?
If you are not understand with any point, then please tell me.
Okay.
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 Sir.
And you can
Yes, sir.
ask me personally, no problem.
Okay.
Good night, Prof.
All right,
Okay.
sir.
Okay, my sister.
Good night. Thank you.
Thank you so
Okay
much.
to everyone.
Good night, everyone.
Good night,
Good
bro.
night. Good night
Thank
to
you
my
very much.
brothers and sisters.
Good night, all.
Good night, all.
Yeah, good night. Good night. Good night to everyone.
Good night, oh.
Yes.
Good night, sir.
Good